So when I look back at my experience with the Health Policy Research Scholars Program and how it's impacted me, I don't think it's one specific illuminating example, more of a cumulative experience participating in the program. When I started HPRS, that first fall institute, I was very much unsure of myself, what my role within the research world or academia could potentially be. And after these past 4 or 5 years of participating in various activities, having the cohort and supportive networks that we have developed, I've been completely transformed to where I now understand what my contributions to team-based science is, how I plan to impact the world of research, the types of research that I want to do, and I have all of these examples of folks who are doing amazing things that I also plan to do for myself. And I think a great example of that is prior to participating in the program, I had no idea of what I would do after the program. I had no idea what a postdoc was. I wasn't even aware of what I should be doing to even apply for an assistant professorship. And now I can say from my participation in the program, once I graduate, I will be starting my postdoc with the National Cancer Institute. And that is something I would have never have dreamt for myself. And I think my participation in HBRS has absolutely impacted my career trajectory. I think in understanding, I can go for things that used to scare me before. And now I know that I'm uniquely positioned to be competitive for these things like my postdoc. I think my understanding of leadership has changed over the past 4 years. I remember starting the program thinking that I was absolutely a servant leader and my role was always to be in the background. I never needed to be up front or at the center of things. And I think now through HPRS, it's helped me to understand that part of my leadership responsibilities is to be at the forefront and center of certain things. And while I still identify with the servant leader, I feel much more empowered to be at the front and center of my cause and ready to field any questions that folks have. I think participating in the case competition, in which we had to absolutely exert our leadership skills in talking to congressmen, different policy folks, and think tanks, that really helped me to refine my leadership vision for myself and also how I plan to interact with individuals at different levels as a leader. My biggest piece of advice I'd give to anyone entering HPRS is to take advantage of every single opportunity that is given to you. You will quickly find that you're completely overwhelmed with the many levels of opportunity, whether it's to participate in team science activities, for grant writing, for publications, to visit other countries on behalf of HPRS and the Robert Wood Johnson Foundation. There are so many opportunities, and your personal life, as well as your research, your leadership, will be completely impacted if you completely immerse yourself in all of the opportunities. Get to know your cohort members, get to know the guest speakers that they bring in to speak with us. There is a wealth of knowledge, both within the HPRS program, amongst the cohorts, and also with the other RWJF Change Leaders program. Take advantage of all of the opportunities to talk to anyone who will listen. I always tell people to identify someone that they see doing something that they'd like to do and just ask them, how did you get there? What were your lessons learned along the way? Just to see what lessons can you glean from that, incorporate into your own lived experience. But I think that would be the biggest piece of advice I would offer any incoming HPRS scholar. In a culture of health within my community, or the community that I work with, I envision this as equitable access to preventative screening, such as cervical cancer, Pap test utilization, or HPV vaccination. And I see the eventual outcomes that people who might be from impoverished backgrounds are not disproportionately represented with some of the negative health outcomes that we see. I also envision a culture of health where I get to align myself with folks who are doing amazing work and seeing, what resources I have to bring back to the community and working alongside one another in order to strengthen the research and practice and community engagement